it will have paperless operation, it can save a lot of cost there, it can have a direct interaction with the patients, it will send notifications to the patients. It will be a great CRM tool. Whatever pains that I talked about as an individual, as a patient, this is going to help CRM activity for the healthcare providers. It will build a loyalty program, it is definitely going to be secured. Now, when I say this, is it all true? No, it is going to take time. It is definitely some certain things that is there on the roadmap, but it is going to need some critical success factors in the form of help from the government, making sure we are talking about mobility devices. Do we have that kind of connectivity of 3G all across? Definitely those are dimensions that we will look at for making sure that this is successful. Thank you.
Thank you, Mr. Suresh Kulkarni, for a wonderful presentation. Yeah, we have a lot of problems. The data resides in silos, and it's very difficult to kind of integrate the data in healthcare. We have data coming from different systems, different medical devices, and probably interruptedly can come in and kind of help us in this problem. So thank you, sir. I would like Mr. Primanshu Singh to take it over and discuss the patient experience. Yeah.
Hi, my name is Primanshu. I represent Practo. So a little bit of how we began. So Practo started with a bad patient experience, right? The founder wanted to find a knee replacement surgeon for his father, and he went through hell. He couldn't figure out which doctor to go to, where to find him, what time is he available, lots of pain points. And he said, hey, that's a problem that technology can solve, right? I mean, in these days, and we looked at examples, and we looked at IRCTC, for example, right? How it changed the way we do train bookings, right? So much of pain was eased. So we said, okay. So we started with the first product, which was a doctor search engine. We said, let's list all the doctors available in India on a platform and make them searchable, right? So by entering all the data points that we have about his qualifications, about what people think about him, his timings, right? And so we began with saying, hey, there are 1 million doctors in India. Where do we get a database of these doctors? And to our surprise, it wasn't available anywhere, right? Nobody knows where these 1 million doctors are. So we said, how do we solve it? So we have our own, so we equipped our team with Google Maps. There are boys on bikes who go on every street in the city, map all the doctors available in the region, and list them on Practo. So that's one. So from a patient perspective, we said, okay, let's solve the search problem first. Once we solved that problem, we began with saying, what are the next pain point? And he said, how does a patient, after searching for a doctor, get an appointment? And for that, we studied a lot of models. For example, we looked at Uber. What does Uber do, right? It says you just use technology to give access to these doctors, right? So we created a instant booking platform. We met a lot of doctors and a lot of patients to figure out what is the right product. And doctors came and told us, we're very busy, but 40% of our patients who book appointments never turn up. So there are a lot of doctor no-shows, right? And you would appreciate the time slot for a doctor is a perishable commodity, right? He books 15 minutes for a patient, the patient doesn't turn up, he's wasted the time. So we said, okay, so that's the doctor part of it. So what is the patient part of it? And the patient said, and we looked at data. So the 51% of all patients who go and see a doctor wait for at least 10 minutes to see a doctor, even with a prior appointment, right? And that's such a huge wastage of time. So we said, let's try solving that problem first. So we said, we will, through our platform, allow patients to look at the calendar of doctors, pre-book, right, an appointment. And this is all free, by the way. And in case the doctor is not available, he can do an RSVP with the patient saying, I'm running half an hour late. If you intimate people in advance, they will plan accordingly, right? So because of a booking platform, what we realize is 50% or 50% more, which is 83% of patients had less than 10 minutes of wait time across the clinics that we monitor, right, which we thought is wow. Then we looked at, we have a product called Instant Booking, wherein you can book without talking to any human being, right, which basically just clicking a button and booking an appointment. And that has an amazing uptake. Right. The point I want to bring is healthcare is just not about doctors and providers. I think it begins from the patient, right? If we are able to provide a better patient experience, and our way of looking at it is products. We believe if you create kick-ass products, you don't need to push it. Like, nobody taught us how to use an iPhone, right? Nobody taught us how to use web or WhatsApp, right? But millions of people, my grandmother sends a picture to me every day on WhatsApp, right? She was never taught. But I think that's a part of great products. So we at Practo believe if we create better patient experience through better products, we're going to create a great healthcare environment. Yeah, thank you.
Thank you, Mr. Premansu, for a wonderful presentation. In fact, this is one of the key challenges to improve patient experience. We can definitely use IT to improve the patient experience. How they can get the appointment scheduling done beforehand, so they need not wait long in the queue. So along with their kids, along with their families. So thank you for addressing this challenge, Mr. Premansu. Now I would request Mr. Bikraman, founder of HealthReach, to take it over.
Good afternoon, friends. The session which we are addressing is today on how technology and analytics can be the solution for tomorrow. I would briefly like to touch upon some of the thoughts which I have, and with my experience over the years, 25 odd years, and the rest we'll probably leave it for our interaction in the session. We all know and we are aware of, and we've heard a few speakers, and we are going to hear about it more through these two-day sessions, that if we have the right data, analytics, technology and services, there is a lot that can be done. I mean, today's healthcare scenario globally shows us that there is a value saving across each area. You call it readmissions, how many readmissions could be saved, and the value or the $1 billion which could save behind that. Coordination of care could be managed better if the cases were picked up early, especially the chronic diseases. Treating them earlier could save high costs, which otherwise we tend to spend on the care provided to those patients. And likewise, if treatment for other critical cases are provided in time and right diagnosis is provided in time, again saves us a lot. Pharmacy, we have always heard about that dispensing of pharmacy drugs on time, providing the right medication at the right time, again saves a lot of money through the process. So this is something which we are all aware of, and that how much data is critical to us, and if that was to talk and integrate it, it helps all of us in saving a lot of money in the healthcare system. Having said that, I want all of us to ponder a bit that is it only the technology or the data which is required, and that if that was to come one day and get all integrated, is that the answer, or a bit of a digression towards that the physicians and the medical fraternity also holds equal responsibility? Today, the fraternity, I understand, and I am part of the system, of the healthcare ecosystem, would want to say that, yes, get us the data, get us evidence, and we would love to see that and want to take a diagnosis. But that's not true. Globally, we are seeing that the rate of medical update, which physicians or medical literature which every 5 years, that hardly 81% physicians spend less than 5 hours per month reading articles. I mean, and folks, that's a matter of concern. With the environment which we are moving in, and I know the pressure stress is not only into the other industries, it's to the medical sector as well. But with that stress, are we updating ourselves enough to be able to, if tomorrow the data comes to us, would we be able to still take the right decision in terms of the diagnosis to the right treatment, plan of treatment? That's important. It's just not finding the physician. It's about the plan of treatment, and the diagnosis needs to be right as well. And that's something which I want to leave a thought with you all as I go move on. All stakeholders, all of us, I mean, be it in the provider space, the patients, the payers, the government, all of them are looking up to the new healthcare system and what are the possibilities in the healthcare system. Be it the foundation, what the healthcare system depends upon, intelligent people. Who doesn't want quick decision makers? Accurate diagnosis and treatment, I just spoke about, that's so critical in the whole process of continuum of care. Innovators, flexibility and dynamism, and people being the complete healthcare managers and professionals being technology friendly. Intelligent tools, we've spoken about a few, we will talk more about it through the day. Highly specialized clinical advanced technology tools, which gives a good view across the complete life cycle of a patient and of the procedures done, pathways, etc., being examined very well from a 360-degree view. Very important. That looks at, helps to save quality, it brings in safety, helps us manage costs. And finally, it all has to come about to creating an intelligent system, which is patient-centered, technology-enabled, yes, clinical evidence-driven, very important that whatever you drive and decisions we take for tomorrow, and for patients, particularly our end user, let's not forget him, being patient-centric, that the end user needs to be taken care of and ensure that his decisions on diagnosis or treatment plan is evidence-based. And reduce treatment variation. And this is where we are moving towards. That's the space and area environment where all healthcare practitioners, hospitals, healthcare facilities need to keep working upon as to how to bring in efficiency within the system. So it's people, tools, and a system being created. But what would it take to create this intelligent system? Can we work in these silos that some people have intelligent people, but they don't have the tool, they don't have the system. Some people have the data, but they don't have the people, and they don't have the right bandwidth to be able to explore that data and put that data to good use. Someone has bought a very good, fine EMR system, but the challenges of being able to get not garbage in, garbage out, but be able to get good data and the right people to feed in the right data. So it has to be, so it's a bit of all of it. You have to be patient-centric, you have to have robust monitoring system, big data capabilities, collaboration, and I'll come to that later some point. Collaboration across the sectors and segments which we spoke about. It's important that we bring in some standardization and uniformity. Comprehensive connected healthcare data and analytics is the answer for this. If we are not able to connect, talk with each other, and bring in all the information, and some of my colleagues, speakers, they just spoke about of how information has to be talking to each other and the patient's data from various formats, be it his demographic to his pharma exchange, which he carries out to payer, as well as hospitals where he goes for an outpatient or an inpatient experience. All of that has to get connected and integrated. So it is important that we get a singular view of the data, and it's dynamic. Yes, protection is very critical in our space and here in terms of data when it's being shared, but it's all very necessary to get integrated. Otherwise, it's all working and talking in silos, and that's where we have challenges. We have some bits of each of the intelligence system, but they're not talking to each other. And therefore, that is something which we need to pay attention to. With this background, knowing where we are, we as an organization, HealthReach, decided to seeing a concern across, yes, clinical treatment and diagnosis is very critical. Users expect the best clinical treatment for themselves, and therefore they want access to the best doctors. They want access to the best physicians in the world. If we can get them, and you can provide them access to the person who is able to look at their clinical concerns, clinical diagnosis of whatever their primary opinion has come to them, and draw a assessment out of it to be able to help the physician and them to implement on a clinical pathway or a plan, is what they would require and desire. And therefore, the whole effort is towards working with organizations and individuals to be able to, as what we spoke about, that longitudinal patient data is critical to be collected. The patient data has to be assembled, has to be managed and brought together for to be able to understand his continuum of care till now, whether be it his interaction with a physician at an outpatient level, primary physician level or hospital level, his other information from the pharmacy, collate information, comprehend them, and then be able to send it to the physician, a finest physician, one of the physicians who depend on evidence, physicians who are depend on being objective, and who are away, or I would say a bit steered away from pure financials. I don't want to deep dive there, but that's the whole idea, that we have to have a process where we are able to collect the patient data, provide, and all his longitudinal data comes across. We are able to comprehend that, and as a case, send the clinical summary to the physician and an authority to be able to respond and be able to advise the primary physician on a pathway for the right diagnosis, providing the right diagnosis and the treatment going forward. So we will talk about this further. There are areas where each one of us has a role to play, be it the government, the provider, the payer, and the pharma. And we would probably discuss this over the session. Thank you.
Thank you, Mr. Bikram. Information is another kind of nervous system of the healthcare. There's a lot of data in terms of volume, variety, and velocity. So definitely, if you can give a comprehensive, complete view of the patient to the doctor, I think it would be really good and improve the care continuum. Thank you, Mr. Bikram. So now I'll request Mr. Vamsi Chandra to take it over.
Yeah, so what I would be talking about is IT enabling healthcare delivery, global best practices. I know there's Dr. Balaji from HCG. I know the members from the Army hospitals are here. I know there's representatives from AIIMS. If there are members here from different hospitals, can you just raise your hands? So good, I guess I see another 3-4 hands. So Dr. Neena Pahuja yesterday requested me to actually specifically talk about HIMSS EMR adoption model. It's a global best practice which is being followed across Europe, United States, Asia Pacific. Even in India, we have Apollo Chennai, we have MAX, which are at stage 6. It's a very good practice. I'm going to spend some time on it because Dr. Neena felt that this is something that should be shared with everyone else. I'm probably going to touch about ACO, so you know that in the US right now, pay for performance is moving to pay for services. So it's basically how the patients become, if the patients become better, they're more healthier, the hospitals actually get to make more money. I guess we are a little time away. There are similar models in Singapore, in Spain, in Visalud in Spain, and other such models do exist. Population health management, more commonly known as POP health, is something which is now a rage across most of the developed countries, and this is something where the governments are really interested in, so I'm just going to touch upon that. There's so much discussions that are happening about digital prescriptions, I won't touch on it. Not too much on utilization metrics, but these are some of the best practices that needs to be adopted by hospitals, and definitely hospitals and clinics. The HIMSS Analytics EMR adoption model has got basically 8 stages in it. So starting at stage 0, where there is, so there is actually no systems. So let's say that it's just a paper-based system. Then stage 1 is where you have the laboratory, radiology, pharmacy as different systems, or one system which is basically over there. See, it's very important, as long as you have medication data, lab data, and radiology reports available, you can at least reconstruct. I'm taking an example of a crime scene, where you can pretty much like go and reconstruct a patient's, probably a differential diagnosis. We might not be able to reach a final diagnosis in every single case, but there are a whole lot of areas where at least you can reach a differential diagnosis, understand what's really happening to the patient. Stage 2, you have CDR, your clinical data repository, your controlled medical vocabulary, clinical decision systems may have document imaging, some kind of interoperability capability that exists. Stage 3 is core protocols being available from a nursing perspective, clinical perspective. The documentation is available, all the flow sheets are there, they're mandatorily filled up. Entire clinical decision support system, at least the basic, not entire, sorry, basic of error checking is available. So ensure that there is no drug-to-drug interactions which are there, or drug-to-food, or drug-to dosage calculations, duplicate dosing. So at least those basic hygiene factors are checked by the system. And definitely there's a